Good morning, PT on Ice podcast. Happy Monday. Happy last week of the Open. I hope everyone is enjoying their time, getting fit, getting fitter, and comparing their scores to last year. My name is Dr. Jessica Gingrich. I am a teaching assistant in the pregnant and postpartum division here at ICE. So today we're going to take a deep dive into what a normal menstrual cycle looks like. So we're going to kind of be playing off of the last few weeks. A month ago, I did another podcast on the menstrual cycle. Christina did. So we're going to just keep hammering the importance of understanding and talking about the menstrual cycle. So before we do that, I wanted to go over some course opportunities. So we have 2 courses. We have an 8-week online course and a 2-day live course. The 2-day live course is wonderful. We learn the internal pelvic floor muscle assessment. We do that in a supine position. We also do that in a standing position. This can be wildly informative, especially for the athletes, the people who are experiencing symptoms in a standing position. I say athletes, but I'm going to say everyone because that's when people are typically experiencing any type of pelvic floor dysfunction. We are going to bridge that with exercise. So this is going to be return to exercise, whether that's postpartum or starting. This is going to include running, jumping, gymnastic skills like pull-ups, rope climbs, muscle-ups, toes to bar, and then most importantly, barbell work. So if any of this speaks to you, head over to PT on Ice podcast, ptonice.com to see when we're closest to you and when you would be wanting to sign up for that. My light is automatic in my room, so we'll turn off periodically. Okay. So today we are going to talk about that normal menstrual cycle. The reason I chose this topic for today, well, there's a lot of reasons, but I've been having a period since I was in middle school. And recently getting into the pelvic space, I was learning more and more about it, what's normal, what's not normal. And I didn't know. I also didn't know what could affect it. And the more I'm in the clinic and I'm talking about it, the more I'm realizing that a lot of people don't know what a normal menstrual cycle is or what it should look like. So what we're going to do is we're going to essentially go back to middle school health class and talk about the reproductive organs. So when you have a patient come in and you're talking about the menstrual cycle, we need to first understand that not everybody knows what their reproductive organs are, how they function. So when we're talking about this in the clinic, we need to be sure that we're educating without like a threatening or judgmental tone. So staying away from words like obviously, or I know you already know this, because some people don't. And a lot of people don't. So we're going to first talk about the ovaries. So the ovaries, this is where the oocytes or the eggs are released and they travel to the fallopian tubes. Muscular contractions and cilia move the oocyte to the uterus. Fertilization actually takes place in the fallopian tube. And the uterus is where the implantation occurs and is made of smooth muscle. This is important because when a woman goes into labor and she is delivering her child, this is the smooth muscle is going to be what's contracting to push the baby out. During our cycle, we have fluctuating hormones. We talked about that about a month ago. The most prominent being estrogen and progesterone. The menstrual cycle starts on day 1 of bleeding. Like Christina mentioned 3 weeks ago, the first 14 days is the follicular phase. The early follicular phase is where bleeding is happening and both estrogen and progesterone drop. The second 14 days is the luteal phase, where the hormones rise. The average length between bleeds is about 28 days. This is important. It's about 28 days, but it can range between 21 and 35 days. As ovulation begins, we see a spike in estrogen, but progesterone stays low. If this does not, excuse me, in the mid-luteal phase, progesterone begins to rise and as the body prepares for pregnancy. If this does not happen, we get a drop in both estrogen and progesterone and the cycle begins again. So in no part of our lives are we not somewhere in our cycle. When estrogen and progesterone are low during the early follicular phase, this is where we've seen some athletes actually feel and like report being not as strong, a little more fatigued. When they go to the gym, their weights are feeling heavier than they used to. This is typically when the female is actively bleeding, but that's not always the case. We are seeing that clinically that this is happening sometimes when women are ovulating, maybe it's a week before. And so just getting a baseline and what's normal for the athlete in front of you. This is something to consider in programming strength, intensity, and as well as educating on the importance of good sleep hygiene and then protein intake during this phase. So what happens if your patient isn't getting their period? This may be due to things like birth control or other things like PCOS, underfueling, or pregnancy. Asking if they are intentionally not getting their period. So this is some birth controls, you're intentionally not getting a period. Also during pregnancy, you're not going to be getting a period. Or if they just haven't gotten it and they don't really know why. This is a great time to educate on norms and its importance to their health. If they track their cycle under your care and you notice that it's not within the 21 to 30 day window, or if their symptoms are really bad, so their PMS symptoms, they're nauseous, they have headaches, they're vomiting, their cramps are so bad they're calling out of work. This is a wonderful time to reach out to people in your community and help build the army behind this patient. You could help someone get pregnant if that was their goal. You could help someone not get pregnant if that's their goal, or just improve their overall health, whatever their goal is. The bottom line is women should be having first of all, they should be having a menstrual cycle. And secondly, it should be normal. It is important for reproductive health, of course, but it's also important for bone health and muscular health and so much more. So to recap, ask your patients about their cycle. Is it normal? Do they or have they in the past ever tracked it? Do they even know what normal is? Do they feel those PMS symptoms and how bad are they? Are they just mild cramping, mild fatigue? That can be normal. And do they notice a difference in their workouts or when they're doing their rehab at any particular time in their cycle? If you are a provider that feels uncomfortable talking about this, dive into it, learn more about it, because this is a space, whether it's you're in the pregnancy, postpartum, or pelvic space, but if you are not, you're in general orthopedics, this could be related to someone's injury. And so asking these questions, you can ask that. Hey, I'm going to ask you about your menstrual cycle because this could be related to what you're experiencing right now. So with that, I leave you. I hope that this is something that you can get comfortable talking about. I typically will review my words in my car on my way to work or in the shower just to get comfortable saying these words. So I leave you with that. I hope you all have a happy, wonderful Monday and a good week.